Good morning, everybody. Welcome to the 9 a.m. spot on today's version. Welcome. We have a really interesting couple today. We have John Smyk and Floreden to talk about their experiences during COVID-19, which is quite interesting. Quite interesting story. John actually is a longtime friend of mine, also a CFO, and so first, what I'd like to do is let's make self-introductions. Floreden, can you just introduce yourself? And move over slightly to the, you gotta move over slightly so we can see you. Yeah, thank you. Could you introduce yourself and just tell the audience who you are and what you do for a living? Can you talk about yourself for a moment?
Oh, okay. Oh, I'm Floreden. I'm working in the long retirement home. I care for the people who needs care.
Yeah.
You're a nurse, yeah.
And a nurse. Okay. And John?
Yeah, my name is John Smyk. I'm a fellow CPA with Bruce. I'm in a number of CFO roles as a fractional CFO and also Chief Financial Officer with Arizona Capital out of Tucson, Arizona. It's great to be here. Thank you to all our first responders, and we're grateful to have Bruce on this morning to have us come on and speak a little bit about a day in the life of a nurse and also an accountant and how we work together to battle COVID-19 every day.
Exactly. This will be a very interesting story. And I'm Bruce Senior, the host of the 9 a.m. spot. And what my company does is we do the 9 a.m. spot interviews and also provide chief financial officers on a fractional and contract basis. And John, of course, is a client of mine. And we've got a long-standing relationship for over 15 years. And thank you, John. Thank you, John, and thank you, Floreden, for doing this. So perhaps we can just start. Just let's have a conversation. Just talk about what is your life like? How has your life changed? You're both engaged. You're engaged to be married, right?
That's right.
You're engaged to be married, and you live together. So now all of a sudden you're working. COVID-19 hits. Well, tell us your story. What has really changed for you? And let's hear your story for both of you.
For me, it changed a lot because of the standard procedure of WHO, and that we need to follow. And in the house, I need to follow the rules too, because it's good for everybody. Because if, let's say, if I bring for John can transport with the other people too. So if John go to the grocery, we need to be careful and follow the rules to wear a mask, bring the sanitizer, and then before you get home, you need to clean up your stuff and then put in the fridge.
But how does that? And John, how does that affect? What about the interaction? How does it? Because you got to follow protocols too. You were telling me, right?
Yes, absolutely.
How does
As
it work?
was alluding to, just leaving the house, you have to think about. I have to think about floor number one.
Okay.
If she's displaced, that's one head count down at the retirement home. Now, Flora is very modest. She's very highly revered by both patients and also by her coworkers. And she does a great job. I can't afford for her not to be at work. So for me, I have to take every standard protocol that's beyond what everybody else, unless they're married or living with a first responder.
Yeah.
My time out of the house is very limited. I'm now in that senior line now, so I get to go first thing in the morning and do the grocery shopping. I'm in maybe 10 minutes tops. I started wearing this about 4 weeks ago. Most retailers are now even insisting that the customers wear it, just in case. So when I'm in the grocery store, we talk about, what's the strategy for groceries for the week? And I go in, maybe 10 minutes tops. Everybody's on protective gear, personal protection equipment. You see it even with retailers now. And so I always ask people, always remember to wear these, because you never know if there's a first responder even in the grocery stores.
Got it. You were telling me.
Protect it. So there's a lot of things that we have to think about where other people are concerned, and I'm still getting used to this, and
Of course.
I have to think about, again, a first responder. Luckily, my father is a retired fire captain, so we've always understood certain things to do and not do.
But John, like we were talking before, and by the way, I encourage everybody, and just see Greg Scott. Hi, Greg. Okay. Hi, Greg. You can unmute yourself. You can feel free to unmute yourself.
Hi, Bruce. How you doing?
Hi, Greg. Greg's also, by the way, Greg is also a longtime CFO friend of mine. Okay. I think there's lots of those. Okay. Hi, Greg. And by the way, we encourage, Florida and John are here. We encourage everybody who's willing to open up their audios and videos and please join the conversation. We encourage you to do that. We want to also enjoy the experience. So please feel free. And as you send your questions in. But so feel free to join in and ask questions. But John, I want to ask you one thing, because you told me earlier, how's it affected your life? You told me what your family, like you haven't seen your kids in a long time. Like because there's an issue there too as a couple, because Floridan's a nurse and you got to be so careful. Can we talk about that for a moment?
Yeah, absolutely. I've not seen my younger son since the beginning of March. As with my parents, we had a family funeral. Unfortunately, my elder son just came back from New Brunswick. He's finally has been degreed from Mount Allison University out of Sackville. So he just arrived back. We had to talk about something. We're outside. He doesn't want to come in. He knows that Flora's a nurse. Everybody is sort of on tiptoes around us. Yep. So, we're 8 feet apart. We're outside. Can't hug. You can't high five. You can't fist bump. You can't do anything. My parents, my father's going to be 88 this year. My mother's 81. God bless them. They're still in a condominium.
Wow.
So they don't have any short-term or long-term care. They're able to exist on their own. Flora's sister has come from the Philippines last year. We haven't seen her in 3 months. She's providing home care, not too far away from us, but as well, these two have to talk on the phone. So it has provided a lockdown where you can't even see your loved ones. We've had Mother's Day. We've had Easter. Father's Day is coming up. This is really hard on families. And it's really hard on us because everybody understands our situation and they stay away from you like it's the Amityville horror. Because they know if they're a potential carrier, we're on lockdown for 14 days.
Well, Florida, you work at Rivera. We spoke earlier. Right now, how have there's been no outbreak of COVID-19 in your retirement home? Is that correct? No.
Yes, no.
How? No, I'm curious. How have you? Because all the there's the whole story. All these retirement homes are going through outbreaks. How have you what's your day-to-day interaction, your daily life at the retirement that actually has prevented people from contracting the disease?
For us, before the lockdown of the government, we before everybody the retirement home the lockdown, we ahead of them, and then everybody the protocol we had to apply to our residents. Let's say other residents they still admitting other visitors like March. Before March, but we locked down already. No one can come to our facility. And then in our facility, if you go down to like having a snack downstairs, you can go down and you can come outside, but you have a social distance. You gotta not sit together. Let's say in the table, let's say if you're having coffee or tea or snack, you have a social distance. We apply that one. And then in our library, it's really like tough to tell them that our library is, you need to ask the person to take the book and return the book. Everything is sanitized.
Well, and by the way, do you have to go through like a certain kind of screening on a regular basis? Like,
oh yeah.
Because people from the outside, like, is it complete quarantine now? In complete, like, can I go in or families go in? No, is it shut down completely?
Oh, yeah. Before, yes, we do. But yesterday, we don't do that. We still have a kind of lockdown, but not really lockdown. We accepting visiting by booking an appointment, but we sit up the 6 feet apart. You can see your family, but you cannot hug. You cannot close to them, but you can talk. Yeah, we have a designated day to do that and designated time. So everybody you can come, but not inside the facility. We have a sitting at our backyard that the family can sit together, but 6 feet apart. And then there's a certain time to talk with your family. After the family done talking, they can leave. After that, they use the chair. We need to sanitize again, and then it's telling again another family to do that. But before you see your parents, we need to check you if you are like fever, and then we make sure that before you meet your family, you have wearing mask properly. And then we have a protocol questions to every visitors. Even though it's not a visitor, a worker, we need to do that in our facility. Check the temperature, protocol of the questioning. We have a question, and then we do. And then if you're good, you can come in if you're a worker. And then if you're not feeling good, like even you say like, I feel not good, something like that, you're not allowed. It needs to 100% to come to work that you're okay. Even though it's not like a kind of COVID, but as long as you say not feel good, I don't know what you feel, but you need to leave the building. And then they ask you to test the COVID before you return at work.
And what do they do before you enter the premises? What do they do? They test you every day. You get tested, like
yes, in and out. In and out. They need to check your body temperature, but before you get in, you need to check the body temperature, and then you need to go to the standard of what do you call questioning, and then before you go to your area, you need to wear a proper mask. Yeah, and then if you are if you go for like, let's say, one of our residents, he needs to doctor's appointment, like eye appointment, right? Because that's elder people, he needs to go to the doctor's appointment. But actually, we have a doctor in our own facility, but we don't have an eye doctor, we don't have like this dental, right? Sometimes it happens to the old people. So if they go to the doctor, we need to isolate them, not to be isolated, but we need to be safe side for 14 days for safe for everybody. Because if you do go to your eye doctor, you don't know what's in there, right? Of course, you are safe, but how about the person who used that chair? How about the person you talk with you? You never know. Because COVID have no symptomatic at all, most of it, but some. So that's why our facility are very, very precautious in terms of our residents going out, but our residents didn't go out except the need of the doctor.
what about as a couple? Are there like we all take a lot of precautions. I take precautions at home, but as a couple, are there extra precautions? Are there written protocols like that both of you? Because John, you're in the game, right? You're not a nurse, but you got the same behaviors, I would think. Are there certain protocols that you're required to follow? Like, guys, how does your, like, on a day-to-day basis, like, the do's and the don'ts?
Okay, for me, if I get enter the house, I need to straight to change your clothes, wash your body, and then I don't touch anything in the house except the knob, right? And then after that, after I change my uniform, I clean myself, I need to go down and sanitize that what I touch.
Wow.
Especially outdoor, right? Because you cannot do that. And then my shoes, I need to be a certain place. Like at work, I leave my shoes there because that's work shoes. And then I use my other shoes to go home. But my shoes don't go to my other shoes. Yeah. It's
so
like
does John shoes follow the same thing? Like John, he follows.
Yeah.
Like, look. Let's be serious. Your fiance, you're a loving couple. I mean, I'm not gonna get into the intimate stuff, right? But you're a loving couple, and so John's shoes, like, is John clothes separate? Like.
Yeah, we don't put together. Actually, let's say our sweater. No, my bag is separate from his stuff, and our jacket is separate with his jacket. Not my jacket will be hung together. No. Even though my clothes, I need to separate because you never know what I bring at home. I wash all my uniforms separately. Everything mine is separate. But before you need to put together, right, to wash. But now it changed a lot. Even though what do you call that one, the stuff that used in the washroom, no. You're not allowed to use this thing to this thing. We need to separate. Because I don't like to be, of course, let's say I have no symptomatic, right? I don't like to be transported with him and he had the symptoms. That's the thing. that I experienced for the most of it is the non-symptomatic COVID, because it just happened like a blink and you never know.
So what is eating dinner like?
Oh, dinner, like I eat at work, most of it. And then if I eat at home, I separate my stuff, right? Boil it. Like washing dishes, John is having a dishes too, but we wash together, but actually don't really like together. In case of it, right? Like a crazy things, but in reality, it's really, we need to be precaution, not to be crazy, but just precaution in case it.
But just to add to this, Bruce, it's like we're living in science fiction times. You come into the house and you're decontaminating. I have a special spot where I have to, take jeans off and shirts, jackets, whatever I'm wearing. And as Flor has alluded to, you're washing your hands. I'm surprised they still have any skin left. But we call hand sanitizer. This stuff, they can't keep it on the shelves long enough.
Yeah.
And as for support here that I do, since I'm locked in at home, I'm doing the grocery shopping, meal preparation. Many times I'm making stews and casseroles and whatever. My culinary arts have come back. I've been self-sufficient. That's how my parents raised my sister and I to be. So I can cook. And having, of course, a fire captain for a father, you understand about fire protocol. So she doesn't have to worry the house is going to be burning down before she comes home from work. But this is how her life is. You can't commingle things anymore.
Exactly.
So our towels are apart. I'm doing more laundry. Flor does laundry every day. As for how we commingle, is that once we're in our domain here, we're okay. We're clean. We're sanitized. We can sit and watch a movie together. We don't have to be in separate bedrooms, 20 feet apart. So our life is as normal as possible at home. I want Flor, she's out there in the battlefield. When she comes home, I want her to relax, because it can be very stressful for her, depending on what's going on, what news they're hearing, what changes that the Ontario Health Ministry is also rolling out. She has to abide by those protocols. So it's a constant refreshing every day, and we take every day one at a time, because I don't know what's going to happen today, Bruce, let alone tomorrow. It's not like building a budget and doing a financial statement report back to stakeholders. This is a very different world.
So a couple things. By the way, again, I encourage everybody. Come on, people, get on and talk. And if you have any questions, it's been nice to see your faces. Please, I'm encouraging everybody to join the conversation once again. But Greg, you talked about the accounting side. So what you're as a CFO and fractional CFO, how has the COVID-19 and the relationship you have because of all the protocols, what has changed for you in terms of your day-to-day life versus not just the norm, we're all working from home, but how has the interaction and the rules that you need to follow and the protocols, how has that affected your professional life at home, working from home?
Well, my professional life has changed significantly. I've been working predominantly out of Tucson, Arizona. We're not working necessarily as a frontline organization, so it's impossible to go back to the office. Really, technically there are some openings to cross the border via flight. However, in terms of external clients that I'm working with, as an example, I have a client out of Pittsburgh. I can't go to the site. It's a commercial real estate property that's changing from one use to another use, and the state's in lockdown. It's one of the little more stringent lockdowns. So my client and I are essentially doing video calls. We're on the phone. Sometimes she can't provide deliverables for me because those deliverables are in somebody else's office, and they can't get to their office. And so we're sort of working as best as we can with what we have available. I have to use technologies, as Zoom and FaceTime, Dropbox as an example. I'm using Canva. I'm really outside the box now with technology. And this has been great. So there's an upside to all this, because if this is a precursor of how we're going to be conducting business, and right now this is the time to start learning. And I encourage all, not just our fellow CPAs, but all professionals to dig in and don't worry, go and learn. This is a great time to look at a very bad situation, but in order to have that interaction, we need to talk to people. We need to talk about our problems and find solutions, and not sort of wait on somebody's cue. Oh, it's okay to go back to work, and we've lost 6 months. We've lost 6 months on projects. So this is what I'm continually doing, is working with my network to find opportunities, and at the same time, let's work at it. We can still develop business relationships and maintain business, even if it means being online.
Has your relationship, getting back to your relationship, the two of you, has there been an effect on your, like, for example, like during 2 to 3 days at work, like, what has been the impact of the relationship on your professional life? Like, what has been the stresses, or, you know, they created, because you're into a new set of dynamics, okay, as a couple, because your fiance is a nurse, okay, Floriden's a nurse, but how has that affected, has there been any like your professional life, has been any effect, you know, in your professional life as a fractional CFO, like in terms of what you do or don't do, you know?
No, I would say no. It's been
Okay.
relatively seamless for us.
Okay.
I think where I'm concerned, it's given me a whole new perspective. Because I'm just thinking now, for anybody that's in the greater Toronto area or out of New York or Chicago, we have massive challenges coming in terms of mobilizing people back into corporate offices and going up elevators. You know, we're going to have limitations here. How many people are going to be working per square foot? And some very high-priced properties right now. This changes a huge dynamic. The blessing for me is that I get to understand from a healthcare perspective from Floreden, as she's telling me how that protocol works and how it's affecting her professionally. The good news for me, Bruce, is that she's opened up and she tells me what's going on. So it gives me perspective on something as simple as an age facility, how that works and how that can be transferred to the rest of us. We don't know the whole impact of COVID-19. We're hearing it's affecting more of the elderly, but every now and then we're hearing stories about children being affected, teenagers, young adults, people in their 40s. So, you know, how is this going to affect everybody? I think this is why we need to have these dialogues, bring in healthcare professionals, give them a forum to speak so that they're able to transfer their knowledge and say, I don't think it's as simple as what government and also the private sector thinks. There is going to be huge changes coming up. And the more that we dialogue and come to consensus, the sooner we can get the economy going. This is really hurting a lot of people. And I feel it sometimes, Bruce, because we're all isolated at home. And it does take a psychological toll on us. You can't go and walk. You can't go to a sporting event. You can't go to the theater. You can't go to your favorite restaurant. These are huge effects on us as people.
Also, look, I have the utmost respect for Floriden. I mean, what she's going to, she puts herself, even though, look, the home has been relatively safe, but she's in a high risk environment. Okay, like,
Absolutely.
and the utmost respect for her for putting herself out there. And because of people like her, people like me are able to stay safe. Okay, and I thank you. You know, and it's really, really something that she goes out there, puts herself at risk every single day, and you're right in the thick of it. So before we end, I just wanted to say a personal thank you to Floriden. My mother's in a retirement home, and 7 people have COVID-19, and she cries. She calls me crying. You know what I mean? Like I'll get another crying call today, and because she literally is in locked up in her home, in her apartment, and is not allowed to leave, and that is indefinite. It's a very, very rough situation, you know. And again, I wanted to thank Floriden for her contribution and for being a healthcare hero, you know. And
She certainly is. She's very modest. And Bruce, send your mother our love.
Hero.
Send her our love and support. I'm a huge advocate for
Absolutely.
elderly population. My aunt that just died, my great aunt in March, she was 101 in one
Wow.
half years.
Wow.
And so there's longevity in the family. My grandmothers lived into their 90s. They're not here to experience this. They faced the Great Depression, World Wars, and all that history back in the 20th century. They're not here to see this now. But God bless our seniors, and I have the utmost respect for Flora and all our healthcare professionals that are looking after our elderly.
Thank you. And we're going to end off, but today, just the last note before we leave, it's a new definition of leadership out there. You know what I mean? Used to define leadership as Doug Ford's leadership. Trudeau's, that's not leadership today. Floreden's leadership. You know what I mean? Different kind of leadership, you know? And so, John, before we end up, is there anything that you want to share or Florida want to share that you think the audience should know that we didn't talk about? And is there something else that we want to just share before we end it in a couple of minutes? You know what I mean?
For me, maybe like only be precaution. Don't be like crazy about cleanliness. Always like precaution. Every time you come out, bring your sanitizer, wearing a mask, and then always clean your hands.
Thank you. Thank you. Thank you, Florida.
And I guess for me,
last word? Yeah.
Yeah, just a couple of things. Very quickly, if you are disposing of your PPE, please put it in the trash. I go out the odd time to meet Flor. She wants me to get out, get some sunshine, and I see latex gloves. I see disposable masks all over the place.
Wow.
So we're forgetting environmental at the same time. I'm not a tree hugger, but I just believe in what's right and just. And the other thing is, if anybody feels despair during this lockdown, reach out to people that you love and support. And even for me, if I'm a contact for you, give me a call or send me a text or whatever. I'm also here for my fellow professionals out there, because you never know when you need somebody to talk to. And don't feel depressed. Feel good about yourself and just stay as best as you can in the game.
Thank you. Thank you.
You're welcome.
Thank you. Anyways, Greg, nice to see you, Greg. Nice to see you again. Always good to see you.
Greg.
Always good to see you. You know what I mean? And thank you, Florida, and thank you, John. And this comes to an end. If they're not in a spot, we'll be back again for another. We got some more things coming up, and have a wonderful day. And thank you so much.
Thanks so much.
Stay safe.
Take care.
Take care, everybody.
Take care.
Everybody, be safe. Keep safe and be well. Thank you. Thank you.
Keep sleeping well.
Thank you. Bye-bye.
Bye.
Bye.
Bye-bye. Bye-bye.
All right.